Dr. Spencer Holover is my partner and good friend. He joined the practice in 2004 and has since had an integral role in designing our surgically based long-term weight loss program. His warm and friendly personality integrates him to his patients and their families, and together with his unparalleled surgical skills are just two reasons he has been voted by the Consumers Council of America's list of the top surgeons in the country. In addition, he has received the Patient Choice Award as one of New York State favorite physicians multiple times and was awarded one of the most compassionate physicians in the country multiple times as well. He is one of the first and most experienced surgeons on Long Island to perform single-incision lap band surgery. Dr. Holover has been performing bariatric surgery since 1999. He has performed over 450 sleeve gastrectomies, 1,200 gastric bypasses, 1,800 gastric bands, and 500 revisional procedures. In addition, he has conducted over 13,000 surgical endoscopies, making him one of the most experienced surgical endoscopists and minimally invasive revision surgeons in the country. He is also a New York State Police Investigators Association police surgeon and has been featured as an expert guest on CBS News, KJOY, Telecare, WHPC, and many other television and radio programs discussing bariatric weight loss surgery.
Hi, I'm Dr. Holover. I grew up in New Jersey and have lived most of my life in the New York metro area, so I have a close identification with the lives of most of my patients. I am a fully board-certified surgeon, a fellow of the American College of Surgeons, a fellow of the American Society of Metabolic and Bariatric Surgeons, and serve on their professional liability committee. In addition, I'm a member of the Society of American Gastrointestinal Endoscopic Surgeons. After receiving my medical degree, I completed my general surgery training at St. Barnabas Medical Center in Livingston, New Jersey. After St. Barnabas, I went on to do an advanced bariatric, laparoscopic, and endoscopic fellowship at the University of Pittsburgh Medical Center with the pioneering bariatric surgeon, Dr. Phil Schauer. While in Pittsburgh, I held the academic appointment of clinical professor of surgery and was privileged to have the opportunity to perform cutting-edge research in modern bariatric surgical treatment techniques. I also gave presentations at major national medical meetings and have helped train future and actively practicing surgeons in these latest surgical techniques. In 2003 and 2004, while I was at Pittsburgh, I performed the sleeve gastrectomy, which makes me one of the earliest surgeons in the world to do this operation. As a matter of fact, in 2006, I published one of the earliest papers ever written on the sleeve gastrectomy from data that I collected during my training in Pittsburgh. I have performed over 1,200 laparoscopic gastric bypass and 1,800 lap bands and 450 sleeve gastrectomy procedures. Together with my partner, Dr. Sean Garber, I was one of the first surgeons on Long Island to perform single incision lap band surgery, also known as SILS, which eliminates all or most of the scarring and also reduces pain and recovery time for our patients. Dr. Garber and I are perhaps the most experienced surgeons in the country utilizing this new technique, and we actually teach this procedure to surgeons across the country. In 2008, our practice made a significant investment to become the first and to date the only bariatric surgery practice in New York to have a state-certified endoscopy suite right here in our office. This gives us the ability to screen our patients for surgery right in our office, as well as to help diagnose any problems patients may develop after surgery instead of having to refer patients to gastroenterologists with little knowledge of bariatric surgery. Dr. Garber and myself are the most experienced surgical endoscopists performing minimally invasive revision surgery in the U.S. We perform the NYBG endoscopic Rose procedure, which is a minimally invasive revisional surgery. In addition, we also perform other revisional procedures that help former patients who have had failed gastric bypass procedures re-achieve their former successful weight loss. We also perform the esophagus procedure for the treatment of gastroesophageal reflux disease.